This video is intended for use by healthcare providers. You may be watching this video because you're interested in or have recently ordered Myriad's myRisk hereditary cancer test. Myriad myRisk focuses on 8 hereditary cancer types, providing you with results that are clinically actionable. The report will include a myRisk genetic result and a myRisk management tool, which assesses personal and family history of cancer to provide appropriate medical management recommendations based on medical society guidelines and cancer risk assessment models. The first page of the Myriad myRisk report is the myRisk genetic result. It will indicate whether the patient is positive for a clinically significant mutation as indicated by a plus sign and a red box, or negative as indicated by a minus sign and a green box. The myRisk genetic result page provides additional scientific detail on any clinically significant mutation identified, including appropriate nomenclature of the mutation and its clinical and functional significance. In the subsequent pages, you may find the myRisk management tool. This valuable addition to the report provides referenced cancer risks and guideline management considerations based on the patient's genetic information and family history. It will use a similar color scheme to show the degree of cancer risk. Red represents high risk and orange represents elevated risk. For the patient to be considered high risk for a given cancer site, the increase in risk must be approximately threefold or higher than that in the general population. The absolute risk of cancer must be approximately 5% or higher, and there must be significant data from multiple studies supporting the cancer risk estimates. Any increased risk that does not fit this profile is generally considered elevated. The standard mutation-positive myRisk management tool will include the following important pages: a summary of the genetic result and the patient's personal and family history provided. You will find an overview of the patient's genetic mutation or syndrome and a table showing its associated cancer risks as compared to the general population. Following is a page on guideline-based medical management considerations. If available, specifically, management considerations that differ from the general population are reported, which include but are not limited to surveillance beginning at a younger age and/or more frequent screening intervals. The myRisk management tool is intended to raise medical management awareness regarding genetic mutations you may not be familiar with. Negative genetic test results are also typically supplemented with a myRisk management tool. The patient's myRisk management tool uses validated risk models and professional guidelines, such as NCCN, to provide medical management considerations based on the patient's personal and family history. The guideline-based medical management recommendations are intended for cancer risk reduction and provided for informational purposes. They are not to take away from a clinician's judgment and responsibility, as individualized care should be based on careful review of all patient factors. As such, no information is provided related to the treatment of a previous or existing cancer or cancers, or colon polyps. If a genetic variant of uncertain significance is identified, there will also be a gray box in the management table to note that it is not currently considered clinically actionable. It is important to convey that variants of uncertain significance are continually assessed by Myriad's industry-leading variant classification program, myVision. myVision uses traditional methods as well as established variant classification techniques unique to Myriad to reduce uncertainty and increase clinical actionability of your results. Through variant classification, myVision has an immediate impact today and into the future, as understanding advances and information that is clinically actionable is disseminated to providers through timely amended reports. This represents Myriad's lifetime commitment to continually provide accurate and timely results for each and every patient. To provide additional information beyond your results disclosure discussion that may enhance your patient's clinical experience, Myriad has developed readily available resources including positive and negative result patient brochures that address frequently asked questions. If your patient has specific questions or concerns, or if you have further need for result and variant clarification, Myriad's internal support team of genetic counselors and medical specialists are available to assist. Contact information for this team is included in every genetic test result. If you have questions regarding your patient discussions using Myriad myRisk, you may contact your regional medical specialist. By providing best-in-class clinical, financial, and patient support, Myriad is your trusted advisor for hereditary cancer risk assessment and the gold standard in hereditary cancer testing. Thank you for watching. To learn more about myRisk, please visit myriadpro.com/myrisk.